We'll be chatting about this throughout the show.
Thank you so much, Chastity. Do you constantly wake up with foot pain, especially in your heel? That pain you're feeling may be because of plantar fasciitis. Dr. Russell Hudgens from the Alabama Orthopedic Center at Springhill Medical Center explains what plantar fasciitis is and how the condition is treated. This morning, we're at Alabama Orthopedic Clinic on the campus of Springhill Medical Center, and I'm with Dr. Hudgens, and today we're talking about plantar fasciitis. Did I do it right?
That is correct.
Said it right. Okay, what exactly is that?
Plantar fasciitis is a fairly common condition that people come to see us because of pain, particularly on the bottom of the heel, but frequently people refer to it as a heel spur.
Okay, and what are the symptoms we need to look for first?
Most typical is going to be pain, and it's usually pain first thing in the morning when someone gets out of bed.
Okay.
They step down, feels like a stone bruise on the bottom of their foot. Sometimes walking around 10 steps or 10 minutes, it resolves, unless A, they stand on their feet all day long, or if they sit down for a period of time and have to get back up again. Usually there's not much swelling associated with it. There may be a little burning in the foot, but frequently the pain goes away once you get off your feet.
Is there anyone who is more likely to have this happen to them?
We see it in certain populations. We'll see it in people that are overloading their foot. In that case, it's, for instance, recently we've had the runners in the marathon here in Mobile, and they get it frequently just because of the mechanical stresses of overloading the plantar fascia, which is a tendon on the bottom of the foot. So it's like a tendonitis in that case.
One thing that everyone who watches Studio 10 knows is I love my high heels. What about high heels? Are those a problem?
Not usually. Okay, they're not a specific problem or a risk factor.
Okay.
You can still wear your heels. We do see it a little more common in people, though, that are flat foot or the opposite extreme, which is high arches.
Okay, very interesting. Now, is there a treatment for something like this?
There is. There's a lot of times when people come to see us with this, it is a sort of a chronic, slow progressing, and a lot of times the pain goes away by the time people start worrying about it, but it keeps coming back just about every day when they get up in the morning. But the treatments are fairly easy. Most people at home have already tried to wear some type of shoe modification, some heel pads, some arch supports, which are very appropriate treatments, and so that we call that orthotic treatment. So modifying the shoes is certainly a reasonable thing to try at home. What we do when patients come to the office for that, there's kind of a triad of other things we try that usually all three together will be helpful. A combination of exercises, some stretching of the foot and ankle and arch. We'll prescribe some medication in the form of an anti-inflammatory, and we usually prescribe an ice massage, which I usually tell people the easiest way to do that is with freezing either a water bottle or a Coke bottle, something that's fairly rollable, and rolling it on the bottom of their foot.
And this is kind of what we're looking at here, right?
Correct. This is an example of someone who actually has a heel spur. The attachment of the plantar fascia is a broad tendon at the base of the heel that runs down all the way to the bottom of the foot into the arch, and it supports the arch. When you step down, if there's some inflammation, as you step down, it stretches that arch and it pulls, and this develops what's called a traction spur on the bottom of the foot.
Is this pretty common or uncommon?
It's actually fairly common. If you talk to probably 1 in 5 people that are at least in some kind of physical activity like runners or joggers, they'll tell you they've had a bout of plantar fasciitis.
About how long does it take to go away?
A long time. That's the sad part.
Okay.
If you can recognize it and know that's what it is very early, possibly getting on an anti-inflammatory, and the stretching and icing may keep it from becoming a prolonged course, but frequently it may last many months, and it can be very prolonged and sometimes even disabling because people can't really walk real well when it happens.
So as soon as you start to feel that pain on the bottom of your heel, that's when you need to see a doctor.
The earlier you get treatment, the quicker the problem may be resolved.
So if you're having any heel pain, make sure you come see Dr. Hudgens.
Thanks, guys. Up next on Studio 10, we're